So happy December. I know that we have lots of holidays, activities, and certainly the weather has told us that it is definitely winter. I was thrilled to have the opportunity to have many of our staff participate in a Thanksgiving meal drive. We provided over 680 meals to our community members. Really a huge shout out to each of them, and it's just such an important part of what we do. In addition, it was wonderful to be with Mayor Mansue of Mullica Hill as we lit the Christmas tree for the Lights on Main. Obviously, we are the main sponsor of that event, and we are just so excited to be part of it. Literally gave out 3,000 antlers on Main Street. It really was such a joy for both the children and the adults, honestly. And it's just a small thing, a small token to say happy holidays and that we are definitely honored to be part of this very, very important community. Today, I also want to mention to you that we were honored to participate with our local prosecutors on the Do No Harm press conference. Bringing awareness to the opioid crisis, all of us know that we have lost too many loved ones to overdoses, and we just continue to see this epidemic happening. And we're grateful for the prosecutors for taking the lead and also for our participation in it. I know together we can solve this problem. One of the ways that we can showcase the great work that's happening is with some of the recognitions that have received, and we have received many, many this year, and I want to tell you about two more. There are about 100 hospitals in the country that receive a top teaching award, and we have received that in Mullica Hill by the Leapfrog organization. It's a tremendous recognition of the work that's going on, real commitment from our leaders to be able to do that, our physician staff especially, and we really are very honored and are grateful to the Leapfrog organization for this tremendous recognition. Speaking of recognitions, we've received recertification as magnet hospitals in Vineland, Elmer, and in Bridgeton since 2008. This designation is really critically important because it talks about the nursing skills, talks about what they call nurse-sensitive indicators, really making sure that our collective skills are really working at the top of the level. It really, really does take a lot of extra effort and time to submit applications, to have all the work that's done, to do the research that is recognized, and that really shows the commitment of our nursing leadership, and I really want to thank each one of them for their tremendous efforts. So today I want to tell you a patient story about a lifelong resident of Upper Deerfield, John D'Addario. Many of you know him as the deputy mayor. He is definitely somebody who has given back to our community 1,000 times, but like many of us, we find ourselves giving more and maybe not taking care of ourselves. And John was diagnosed with type 2 diabetes, and he found himself just gaining weight and not really having control of the diabetes, and he knew that there were things he needed to do, but it didn't take priority as much as everything else that was going on in his life. And sure enough, the day after Christmas in 2022, he found himself in a severe health emergency and ended up at the Elmer ICU. And what John talks about was not only the tremendous care he received, but the real commitment his nursing team made to really educating him on the things that he needed to do to take control of his diabetes, really be able to live that full life that he wants to live. And he credits his nursing team with really giving him the inspiration to move forward and get control of all of it. They totally invested in him, totally invested in making sure he understood his next steps to be able to move forward healthfully, and really gave him control of his life back. And so again, I want you to see, it's not only when we're in that emergent situation, which obviously is critically important that we're there with you and we stand with you, but it's about those steps after, that we connect you to the services that you need, and you really understand that Inspira is there at every step of the way in that emergency situation, but also in controlling that rest of your care that is needed to be able to go on with a full life. We're so very proud that John allowed us to tell his story. We're so very grateful for both Chuck and Sheila because they really do represent what is so wonderful about the 7,500 people that work at the Inspira family. And I'm grateful to each of them each and every day. I'm grateful to you. I want to take this moment during this holiday season, whether you celebrate Hanukkah or Christmas or Kwanzaa, please know that I wish you nothing but the best this holiday season. Know the Inspira family wishes you the happiest of New Year, and we really thank you for all you do for our community and for allowing us to partner with you on your medical care. Until we meet again, be well and stay safe.